All right, good morning, folks. Today is April 7th, 2023. This is Coffee with Community Services, Alta California Regional Center's weekly vendor meeting. My name is John Decker. I'm the Director of Community Services, and we'll introduce some of our ACRC Community Services and I see some case management staff as well. So we'll get started here. And I'm just going to go through along the line here. So we'll start off. I see Carol Wilhelm this morning, Client Services Manager. Good morning. And one of our SCs, Jolana, is on. Good morning, Jolana. And we have Kanisha. Good morning, Kanisha, Client Services Manager. Helen, our Manager in Community Services, on. Adriana as well from our Community Services Department is on. One of our specialists. We have our Director of Intake and Clinical Services, Camellia Houston, that is on this morning. Good morning, Camellia. We have Shirley from our Community Services Department. Good morning, Shirley. We have another one of our service coordinators, Jessica's on here, and I see Jasmine Kangunyan. Good morning to more of our folks from case management. Let's see, we've got our client employment specialist, Carly. You guys will, maybe you got to learn a little bit more about Carly. She was featured in our newsletter, and we're going to talk a little bit about our newsletter and the employment information that was in there. And we've got Heidi, as always, representing the greater Grass Valley area, right? Christy from our Community Services Department. Good morning, Christy Schaefer. And Client Services Manager. So I see Dana on this morning and Wyatt. Good morning. And Alicia, our HCBS specialist. We heard a good morning from Jennifer Bloom, our Director of Client Services. Good morning, Jennifer. And from Community Services, I see Gary on, another specialist. Good morning, Gary. And Leah's on. And I see our Community Services Manager on, Michelle Duchesne. We've got our Director of Client Services, Michelle Johnson. We have Isabella Vega. Good morning, Isabella, as well from our Community Services Department. And my assistant, Zach, is on here too. And good morning, Veronica from Woodland. All right, we got a full house today. So I was saying that I didn't have much of an agenda, and then I wrote down like 25 agenda items. So we're going to get through as much as we can here, but I want to touch on a few things. So we have the DSP Collaborative. We're going to be discussing about that. We're going to discuss about the new CCL provider information notice that just came out related to testing and masking related to COVID and vaccinations. We're going to talk briefly about the social recreation grants that the regional center has gotten awarded by DDS. We are going to talk about in-person meetings with day programs, and Michelle's going to touch on that. Let's see. We are going to discuss about the broadly about the HCBS grants that we have. You know, we've got them returned back from the department, the ones that have been awarded. We're going to give a little update on transportation, kind of how things are going. We'll have Helen give us a little update on that. We'll talk about the updated DDS directives that are out. And then we will go to our events calendar for Alta as well. So we got a bunch of things to go over for the next 54 minutes. If there's things that you want to touch on and we haven't touched on them yet, please put them in the chat and we'll make sure that we can get to that. I know one of the things that we talked about a little bit earlier is rate increases and kind of the next rate increase and what that looks like. And so we can share some information about that if we have time. But what I want to start off first with is I want to jump over to the DSP Collaborative. So some folks were able to participate in our kickoff events. I think it was last Friday I was doing the kickoff. Was that last Friday? No, Friday before. I did the kickoff event down at Valley Mountain Regional Center when we figured out that my internet access was not quite strong enough to keep a Zoom meeting going for an hour. So with that being said, we've got a number of folks that have already started to sign up. I'm going to share my screen real quickly so you can take a look at the website itself. And let's see here. Jolana, are you seeing the website, DSP Collaborative? Can you give me a thumbs up if you are? All right, perfect. So this is our DSP Collaborative website, and it has been put together by a group from both Valley Mountain Regional Center and Alta California Regional Center. And the website is dspcollaborative.org. You can see the new design that we have here for our logo, leading with inclusion and working with purpose. And there's multifaceted parts of this kind of intervention or initiative that we're doing with Valley Mountain Regional Center. Again, this stemmed from HCBS funds that the state of California had given to the regional center last year and said, you know, please find a use for these funds. We decided that the best way, or one of the best ways, along with our provider advisory committee, to use these funds was to support the hiring and workforce challenges that exist with our service providers. And so part of this initiative is the development of a job board, which is what I want to talk about today. Really want to encourage folks to sign up because we are going to start widely advertising the DSP Collaborative via different media buys that we are doing. And we want you to be able to benefit from it. So right now we have, let's look at San Joaquin County. So we've got 7 vendors that are serving that area. Give you an idea about what the functionality of this website. In Sacramento, we have 9 so far that have signed up on the website. This is a free job board. This is something that you do not need to pay for as a service provider. And again, we are going to be widely advertising this website. And so we really want to have as many of your jobs posted on the website as possible. A lot of you filled out our workforce survey last year and filled it out the year before that as well. So I'll be doing a little targeted emails to all of you that expressed your workforce issues, because I do want to make sure that you take advantage of this free opportunity to be able to use this website. On the website, you'll be able to post, as I said, all of your jobs. Job seekers can come on there and they can express an interest to you. So I'll give you an example of kind of what it looks like. So I will open up On My Own Independent Living, and it gives you an opportunity to customize what your page looks like. So I think you can customize this banner, and you can also add pictures in here from your company. And you can see there's a good amount of information about the company on here. And then it has the contact information, and then you can submit the information directly to the provider from the website as well. So we really want to encourage service providers to sign up for this, take the opportunity to talk about their different types of jobs. You know, we've got Hope Consulting on here, so behaviorists that are on here. We've got care homes. We have ILS, SLS agencies. We don't have day programs, and I thought day programs were struggling to find staff and be able to open up fully in our area. But though we've sent this out to all of our day programs too, 2 weeks ago, I think DDSO is the only name that has popped up on here so far as hiring. So really want to encourage folks to do that. Again, it is a free opportunity. On our website, we have the news and events, and on the news and events, it has the flyers for you as service providers. So if you as service providers are interested in attending the expo, the job expo that's going to be on Lemon Hill on May 3rd, you need to sign up here. Carly's on. Carly's been working on the career expos as well, kind of like with the rest of us. At the career expo, we're looking at it from 10 to 2, right? That's the time frame. And then we're looking at trying to provide some type of food trucks that people can, use on site as well. I think we're trying to get 1 or 2 food trucks on there for people if they want to buy lunch while they are there at the event. And then did we figure out, or are we still trying to figure out if there are breakout rooms where people can do interviews?
There will be breakout rooms for our providers to host interviews on site.
So again, it's 2-faceted. On one hand, we really want you signing up for the website and making sure that your job listings are right there and easily accessible for people to look at. El Dorado County, we've got an FHA, an ILS, SLS, and then an SLS in that area looking for hiring. Placer County, I think there's a lot more need out there for hiring than kind of what we have represented so far. So if we could please take advantage of this free opportunity. This is again been quite a bit of work from the regional center staff and our service providers too. UCP, CLO, On My Own. We've had a number of our providers that have worked on trying to support this website and get it off the ground. So
hey,
I think,
John.
Sorry, go ahead. Yeah, I'm going to stop.
Yeah, I know. I don't know if you've spoken to Scott from Benchmark recently. He and I have been in contact the last week and a half. There's a lot of, there's at least a couple of companies who have signed up and it's not showing up. So I know he's working on something on the back end, preventing entries from showing up. So there may be more people who have entered and for some reason it's not getting through, but I know that he's working on it actively.
I know that we had heard earlier in the week from, I think, Central Valley Training Center that they were having an issue with that, where they had completed it all. It appeared that they had completed it all, but it wasn't populating yet. So maybe next week when we show you guys the website again, we'll have gotten everyone's on there and get it going. So we're just launching it right now. And again, we've got till next Thursday. Or next Wednesday, and that's when we're going to start promoting it. Carly, there's a question. Should we get a confirmation that we signed up for the expo? They haven't received it yet.
I'm not sure. I think Doug is managing
Doug
all of
Woodney.
the registrations.
I think that where we're at is Monday. We're planning on going out there to determine the full capacity of the venue, and then we can determine how many of those that have signed up are going to. We think we can accommodate more than 50 easily, and I don't believe we have 50 signed up quite yet, right? I think we've got quite a few.
We have asked for the full list of everyone who has signed up for our expo here in Sacramento. And then once we get that list, we can reach out to everyone who has signed up.
Awesome. So Sheila and DDSO, so you guys will get a message from the regional center. I think there's no reason why we should not have that all firmed up by next week, considering we're a month out from the event. So, all right. Any other questions related to that? Again, Garrett, Eric, Michelle, they all spent quite a bit of time, as well as vendors from other from down at Valley Mountain as well. Andrea, go ahead, please.
This might be a stupid question because I haven't gone through the whole process of trying to sign up because I get stuck on like the first page, but there will be somewhere where we end up saying like what other areas we serve and stuff, right?
Yes, you are able to choose multiple different areas. I know Michelle ran into that, and there looked like there was a cost money. It looked like it cost like $2,500 or something like that, and so we were removing that confusion from the sign up process. Michelle, I saw your hand up, but then it went away. So,
oh, sorry, I didn't mean to do that.
okay. All right. So we're going to continue to promote this and talk about it. It just went out to the Valley Mountain Regional Center vendors like 2 days ago. And so, again, just want to encourage folks to sign up there. All right. The next thing I want to touch on, many of you are not residential service providers. We don't always get a ton, but we all interact with residential service providers because of the type of services that you all have. And so I think it's good to know what is coming out from the Department of Social Services related to COVID and screening and things like that. I mean, we've got, day programs as well that are running adult programs. So this is an updated information. It just came out, was that yesterday? Just came out yesterday, and it really just explains a lot of the new rules that have come into place related to COVID-19, MPOX, etc. So this applies to all of those license settings that you see there. And you can see the topics here. Termination of the adult and senior care facility worker vaccination requirements. So there's a discussion about that. There's a discussion about screening of persons in care, of utilization of respirators and masking, testing, isolation, and quarantine of people's in care and staff, and visitation. And so there's updated rules related to that have come out. If you are a residential service provider or a day program provider, you should be subscribed to getting copies of these pins. So the provider information notices, try to use less acronyms. And you can see the information right here. So you can see the public order regarding the vaccination requirements was terminated. They have that information in here. It's going to be like this. The requirements have been terminated, but it's strongly encouraged that you have the most protective, processes possible. That's kind of the gist of what you will see throughout the guidance here. Again, there may be masking requirements in some situations in more, strict levels, and especially if we've got concerns with people having symptoms and things like that. So I'm going to take this and I'm going to drop it into the chat box if folks want to take a look at the new pin that has come out from the department. So I'm going to paste that right there into the chat. And then while I'm in the chat, I'm just going to go up there and see if I missed anything else. Oh, good. People are working on it. Yes. Awesome. All right. So I'm going to stop sharing my screen real quickly. So that's kind of what's going on with CCL right now, a loosening up of the requirements. Again, the main thing too is that if someone wants to wear a mask, like a client wants to wear a mask, or one of your staff feel like they want to wear a mask, please, they need to be allowed to wear their masks. If that is fine. Like we shouldn't be discouraging people in any way. I don't know that it really has gone on a lot. I think with some of our vendors for our little kids, we had some family members that were concerned about service providers wearing masks while they're trying to do therapy. But I think we resolved kind of all of those, individual issues. And I don't think it's as big of an issue on a adult services level, but just want to remind folks, please allow, again, your staff to wear masks, the clients to wear masks, if that is what they are choosing to do. All right, I am going to, and I kind of stay on a similar topic, I'm going to run over to the Department of Developmental Services website, and I'm going to show you some changes. Oh, I don't want the chat to pop up. I don't want that. I want to just go to the screen. There we go. And so just talking about some updates, some things that have came out. Obviously, we didn't have a coffee with community services last week. And so there's some new pins that we've got in here. There's an update on health topics. And again, things that are not super surprising to you. Looking at kind of what I just said right now, which is there's been updated guidance that has come out, and people need to be as safe as possible when it comes to dealing with the high risk populations that we do. So that's on DDS's website. And then we also have the end of special incident reporting for COVID-19 and Mpox. So that reporting is no longer required. Again, you can always go on DDS's website and take a look at the directive specifically, but that is not a requirement, and it is not a best practice requirement for our regional center. So what I would say is if someone has got that information, do it as a shared information. I'm thinking all the service providers know what a shared information is, which would be an email to your service coordinator. So that is that information. And there is information. I think I had an opportunity to mention this last time when we met with that. There is a pin, excuse me, not a pin. There is a directive on here related to position statements and exchange of evidence in the appeal process. I'm not going to get into that too much with a large vendor meeting, but you guys are welcome to review the updates that are related to that. And that's tied to some of the previous language from the California budget trailer bill. All right, so let's see here. Next on my agenda, I want to touch on the social rec grants. And so this is going to pop up as a favorite because I do it. Social recreation grants. There we go. All right. So Helen, and Christy's on here, isn't she? Christy, what have your activities been with our social recreation grants lately? Oh, you're muted, I think. Uh-oh. Unmute on your computer, on your keyboard. F4. Oh, we lost you. All right. I'm going to throw it over to, oh, wait, did I hear it? No, that's Helen. All right, Helen.
That was me.
So I'm sharing my screen right now. We can see the list of the awarded grants. Can you give us an update on kind of like where we're at right now as far as the status on these?
Yeah, so Alta was approved. I mean, the applicants that were going through us, we had about 8 approvals for the grant, and we had sent them the award letters. And we are now in the process of having the grantees sign the contract. And so I believe from Christy yesterday that I met with her, we had about 5, I believe, that has signed the contract. And we just need to finalize the contract. And we are on track to probably have all of them signed by next week, if not the end of April. Yeah.
These are one-time ARPA funding. So the American Rescue Act funding is this project. So this is kind of a one-time opportunity that our local community was given. And then we are also looking at vendorizations as well. So once we get these done, can we turn these into vendorizations for our regional center as well? Sometimes people were vendors already, and sometimes people weren't. And we did for those that were not awarded by DDS, because DDS is the ones that came out with who was going to be awarded these, that we had an opportunity to talk with them. Sorry you were not awarded this grant, but do you want to do vendorization with us so that we can get going? So I know we had some service providers that were interested in that. So we're meeting with folks related to that. If you want to look up which ones are Altas, there's a column right here. And so you can just do a search on the PDF and you can see all the ones from Alta that are on there. So you're welcome to check that out at your leisure. Those are the social recreation grants. And as we say, we drafted Christy over from the CPP forensics side of things, of that type of resource development, to do this because it's very similar to when we do contracts for startup for our CPP, CRDP projects. So really appreciate Christy's help and support on the social recreation grants. But I do think that that's going to be a one-time, money. There will not be an opportunity next year for that. All right, I am now going to jump over to, let's see here. I'm going to jump over to Amy McCreary's, and I don't know, maybe Camelia can help me out with it as well, especially if I say something that's wrong. But we have an opportunity, and this should have gone out widely via email to you if you have, in essence, kind of behaviorists that you work with, or if you are a behaviorist yourself. So for example, if you have a behavioral day program, if you have if you are a behavior service yourselves, this is an opportunity to attend a webinar, the Comprehensive and Compassionate Approach for Addressing Problem Behaviors. And it's a 2-day workshop, and it's going to be May 1st and May 2nd from 8:30 to 4:30 p.m.
Hey,
And
John,
I wonder, sorry, go ahead, Camelia.
real quick, it's not a webinar, it's in person.
Oh, sorry, workshop, not webinar. It is in person at Alta in our Brenda Smith conference room, but not a webinar. Yes. And real quickly, maybe you can, let's see, Camelia, if you could drop Amy's email into the chat. And so if someone did not get an invitation to this, and you again work with behaviorists, so for example, we have our high-level care homes that work with behaviorists, and so we are sending this to the administrators of those care homes because we really want them to understand this as well, because this is training that's being received by our many of the behaviorists. So there's going to be CEU opportunities on here as well, and those are being offered through the BACB. Again, Amy is the expert on all of this and certainly could share with you a little bit more. Again, and you should have received an email already if you are one of those vendors that has got one of those behavioral service codes. And so if you did not, please shoot an email to Amy, and Amy's email's there in the chat. Pretty good? All right. Let's see. We had another topic, and I'm going to throw it over to Michelle. And this is related to in-person meetings, right?
Yes, yeah. Can you hear me?
Perfectly.
Okay, perfect. So we just wanted to kind of reach out to day programs and just let them be aware. So we're encountering clients that are reaching out to our case management and sharing that while we're doing our IPPs in person, a lot of our ISP meetings are still being held virtually. So we just want to remind our providers to just be aware of client choice. And if they would like their ISP meetings in person, that our vendors do what they can to accommodate that request.
Questions for Michelle about that? Anyone? Is this something that has come up in meetings or and needs to be addressed further? Again, I think hopefully we can just do kind of a broad reminder / advisement of it, and we don't see that it's kind of an ongoing issue. So certainly if you have any questions about that. Oh, good. We have a comment there from Kenesha as well. So yeah, client services managers, certainly this was something that was addressed to us from the associate client services directors after hearing your feedback. So again, please, service providers, offer those opportunities. All right. Can we get a brief update on the HCBS grants, just kind of where we're at on timeframes for those?
Yep. Good morning. So DDS got back to us about 4 o'clock yesterday to let us know that they had approved 12 of the 36 submissions. So We were awarded $984,000 and we had over $3 million in proposals. So we sent them off March 1st and they just got back to us yesterday saying that 12 had been approved with the list. So either later today or early next week, I'll be sending out approval letters and letters to those who were not approved by DDS for the grants this year. Although those grants are ongoing, so there may be more opportunities in the future.
Yeah, I think that's pretty likely that we're going to continue to have an annual kind of HCBS funding of money we have had for the last several years. So hopefully folks will have an opportunity. Again, it's tough to have when you have that many requests and only have this much money that DDS is going to be able to give to the regional center. But that also means that folks are, trying to really think hard about ways where we can get ourselves and keep ourselves in HCBS compliance. All right. The newsletter. So we had our newsletter that came out as well. And I'm going to share my screen real quickly. So what is this, like edition number 5, I think, or something like that, of our Alta Connections newsletter. And you see the translation into a number of different languages. One of the things that was important for us for this version of it, and just because I don't want to forget about it, is that we really want to get the word out there related to coordinated family supports and getting the request for proposal out there. Because, there's a wide kind of swath of folks that might be able to qualify to be a coordinated family supports service provider. And I know they definitely want us to do a lot of outreach to our communities as well. And many of our clients and family members are kind of in tune with that. And so the nice thing was at the very end of our newsletter, we put the request for proposal. And then that means that it went out in the 9 different languages to I think we got about 8,000 or so subscribers to our MailChimp website. So I am going to pull this up here real quickly. And once again, we have a featured artist this time, and it is Jacob Maddox. And Jacob works out of the Arc of Placer County at Studio 700. So you can see some of his work that he has in there as well. Kind of cool. Nice to have a nice picture of Jacob. I saw it on our social media yesterday too. We have our introduction message from Lori where she talks about things like our DSP collaborative that we are doing. So she's got information in that, and certainly information talking about our, employment opportunities. This is, Lori wanted to do a special edition, just really focusing on employment and employment stories. And so we're going to get into some of those here in a moment. We have shared already with folks that we are working collaboratively with Sierra College. It feels like Carly and I have a meeting almost every week or every other week with folks related to and it's moving fast, I will say, the work that we are doing together. Carly, would you be able to give just a quick snapshot of kind of the 2 things that we're working on with them real quick?
Yeah, so we're working on, one is vendorizing Sierra College for a program that we're looking at kind of recreating the transition to independent living model that Taft College has. So we're going to vendor them as an 055 community integration program and a 520 independent living services. Hopefully down the line, we will be vendoring them as a residential provider as well. They received a housing grant and will be building some dorms. So once those dorms are completed, we are hoping to vendor them for on-campus housing supports. But at this time, we are vendoring them for the 2 services I mentioned to really provide kind of a wraparound service for clients looking to receive heavier employment supports while at school so that they go to school and come out of it employment ready. And we're currently in the vendorization process, and they should be vendored and ready for clients to start their program in January. The second program we're working on is the LIFE program. The Sierra College vendorization is just one aspect of the LIFE program. And we're really looking at establishing kind of just a better pipeline at creating long-term successful employment, figuring out how we can braid all of the current services we have to create something a bit more, sorry, trying to think of the word, a bit more cohesive.
Yeah, absolutely. Again, this has been the brainchild of Dr. Lou Vismara, who is, very, very good advocate and well known for the work that he's done in this field. And employment is very important to him. And this collaboration, communication with the junior colleges is something that has been, I think, is a great idea. As we're serving more and more clients, we're going to have more and more individuals that are interested in this as an option. And so having something up here, having a blueprint that's been kind of developed on how to do it, having Sierra College maybe being kind of the testing place for this, and then disseminating it throughout the state is something that they are very much interested in. So Carly's been working on that one real hard. And then we get into some stories here. So we have 10 years of employment first. So it was 2013 when we talked about, if an individual is interested in employment, that we should put precedence to services to support them to meet those goals, right? It's kind of been highlighted, especially as we're talking about employment right now, that the state of California doesn't really have the best accounting of who is employed. It certainly came out during the Senate Sub 3 hearing for the budget for Health and Human Services a couple of weeks ago when I was testifying there. A session that was right before mine was talking about the end of subminimum wage and talking about, okay, well, subminimum wage is ending. We're getting rid of subminimum wage. Now, how employed are regional center clients? And we don't have a way for all the service coordinators that work in Wyatt Stroman's unit to be able to indicate which clients are competitively integrated employed and which ones aren't. We don't have that measure. And that's one of the reasons why I'm attending a lot of the meetings that DDS is having right now for their new CERMS system, which is going to replace our consumer record, electronic record management system is the new one that they're doing to look at replacing SanDisk. And those are the type of things that we need to make sure we capture, right? Like things like housing needs data and being able to do like reports on those types of things, or looking at things like, as we just mentioned, are people employed? What are, those types of things. Right now, being able to measure employment, Carly talked about this yesterday, so she can let me know if I mess up when I'm talking about it. But measuring incentive payments that go out for CIE is not a good way to measure whether or not regional center clients are employed or not. And that is the big measure that's being used right now for CIE, to my understanding. So again, I think this is an issue that the state really needs to get their hands around. Is if we're we're 10 years into employment first, and we still don't have good numbers about who's employed and who is not employed, and whether or not regional centers are making progress or not. So anyways, that being said, I know I'm very proud of the work that we are doing here at our regional center. We are certainly trying to support as many clients as possible to reach their employment goals. There is a spotlight here on Carly. So our 600 people that work for our regional center and everyone else knows about our client employment specialist. And I think it's great that regional centers have these employment specialists, right? These positions have not been around that long, and it's great that we've got these opportunities to have people that can really specialize in providing these types of as I say, opportunities for our clients. More information here about the ACRC and CIE roadmap. And then we get into the employment spotlights. Carly, how did we gather, and by we, I mean you, because I sure didn't do it myself. How did you gather all of the testimonies and things like that?
Well, we made a call out to all of our providers. So several of our providers, they all did the work really. They gathered these testimonies and they sent in everything. I just ensured that we had all of the releases of information and the photo releases. And just, that's all I did. Our providers did everything.
I hope that this opens up people's ideas about what they can and cannot have opportunities to do. I think, over the years, I know I've certainly worked with a number of planning teams and family members that have questions about people's ability to be out and go and do paid employment. And one thing I like is that you talked about a lot of different types of employment in here as well. That was one thing that we wanted to focus on, right? And not just the CIE, but we've got these folks with their self-employment and their business that they have. So I appreciate all the employment spotlights. And again, if this can encourage folks to do this, I love being able to, we were able to highlight so many of the different companies that folks work with as well, you as service providers. I thought this was really cool from Amen Associates that we actually had like a little note from Paul right there. So yeah, awesome work. And then even covering the state employment initiative. Can you touch, I don't think we talked really much at all related to the state employment initiative. Can you let folks know a little bit about what that is?
Yeah, so the State Employment Initiative is a collaboration between ACRC, DDS, and DOR, and the governor's office to get more of our clients into state employment. So it is still in kind of the pilot program stages, but we're getting to the point where we're trying to get it into some more agencies, get it out of that pilot stage. But so we work with several state agencies, and then to place clients into those positions. DOR handles all of the training and hiring. I work with our service coordinators to get candidates that I send over to DOR. And then we, of course, provide job coaching for anyone who needs it. Clients have to go through interviews with the governor's office to get hired. And then once they spend 2 years in the position, then they, forgive me, I'm not very familiar with the state processes, but they reach their promotional status and they can apply for promotional positions within the state. And so this is actually a great place for me to promote our upcoming Employment Corner workshop on April 12th, because we're going to have a state employment focus in that Employment Corner workshop. We're going to have some people from DOR come and talk about the State Employment Initiative and their state internship program.
Did we send out a flyer for that one already?
We did. We sent it out. Actually, I think Christine sent it out this morning. And it was, if it has not been posted on our Facebook yet, it will be very shortly.
Okay, so let's get that date and time again real quickly.
April 12th. It is in person and hybrid, or sorry, in person and on Zoom, and it's 5 p.m. to 6:15 p.m. And it's for clients, families, service providers, anyone who wants to learn more about how to help our clients get into state employment.
Excellent. Thank you very much. So please look out for that. It's going to go out widely to our service providers, you said?
Yes.
Awesome. Excellent. So keeping on so thank you very much again. Carly had to carry a heavy load on this this particular newsletter that we did. And so I really appreciate getting all of these stories, and just having so many different stories is great to be able to share with folks. So thank you. I believe we've shared these pictures previously, but we also highlighted our tours that we did for our board of directors for the Mirasol Village apartments. And one of the things that was kind of neat about this is we all learned, I don't think I knew about it before, I didn't realize that it was already growing with things, is that there is a community garden that exists within the Mirasol Village housing development as well. This is a big playground that's kind of in the middle of the development, and then there is this very large outdoor garden that they've got set up for the residents to be able to use. And picture here of the Michelles. So a couple of our board members, Michelle Ruritz and Michelle Ramirez, and then Michelle Johnson, our Director of Client Services, of course, and everyone loves wearing hard hats. And again, if you've seen the pictures of our units, they are fully ADA, like some of them. And so you can see where if you're in a wheelchair, can roll right up to utilize this counter space right here. And you might notice that the counters are a lot lower than you might see in other people's homes as well. Microwave mounted, down here too. So we had a great visit over there. And then we've had a couple visits over to the dental clinic. And the first one I got to go spend a lot of time, and the second one not as much, but we took our board of supervisors over there. They got to see the new dental clinic. And we have our dental coordinator, Shannon, who we previously highlighted in one of our previous newsletters. We did information about our new dental coordinator at Alta. So here is this, and then Camellia, we did a second tour as well, right? And that was with the people that are putting on the big grant, and we spoke with the folks from, it was the California Dental Association, right? Was that
Them
it?
and CHAFA, and I'm hard pressed to remember the acronym, but finances, the F is for financial.
So they came to check it out because they're administering, there's a law that was passed, and some Alta staff worked on advocating for it and testifying for it, which was to do a grant program so that they can develop different types of supports for people with disabilities to receive dental care. So whether it's, brick and mortar things to build a clinic, or to do things, I think we're trying to get it stretched out to be doing mobile clinics as well, and maybe something like that, or a portable clinic is something that we're trying to get, because we want to support some folks with a request related to that, I think, possibly. But very nice to be able to have that opportunity. And I did mention that we will be focusing more on the dental clinic and dental services. We'll talk more about it during our next newsletter, because again, things are kind of coming together, especially as Shannon is out there beating the streets trying to find dental providers for us. She's fantastic having someone that can really focus on some of those outreach activities and helping us navigate the changes that have gone on in the dental world too. So again, lots of discussions. I feel like we're having meetings with new interested dental providers every few weeks or so. We had some RDHAPs that we met with, the registered dental hygienist in alternative practice. And then we met with a dentist yesterday that does mobile portable dentistry as well. So again, we're just really trying to continue to make that a big priority for us, because we hear it so clearly from really on the residential side, and from families too, the challenges and being able to get in and get dental work done. And we certainly are aware of that very long wait for the hospital dentistry that's done by Dr. Begal. All right. So we have a client spotlight. So there's Shelby Wright on here, and you can read about Shelby's story that she has on here too. And a little update, we just did a ACRC by the numbers. What I think we'll look at doing maybe towards the end of this year, maybe the end of this fiscal year, is we'll really get a good look at how have we done some growth. Maybe we'll put a little chart on here so you can really see where we're at. I will say between these numbers and intake, by the end of the year, we will hit 30,000. So by the end of the calendar year, our regional center, between early start, Lanterman, intake, will hit 30,000. So we might already be there right now, honestly, with the numbers that we have, or we'll be there possibly soon. So that being said, regional center is getting larger and larger, and that means that we need more service providers to be able to work with our clients. So again, I'd say shout out to our community services department that has been really working on getting these new vendorizations in. Nice to see some of these clinical psychologists on here after all the work that Camellia and our community services staff did on trying to get more vendors. And then also looking at social recreation reimbursements. One of the things that our vendor processor said is, John, it doesn't look like we did a lot of vendorizations, but I just want to let you know how many reimbursements we processed for social recreation. And I will tell you, I know that there was 22 when this was done, but there's probably been another 22 on top of that since then as well. I think we counted in the last month an additional $32,000 worth of billing that was done on social recreation purchases. So there's been quite a bit that is being processed by our community services department. One of our last independent living specialists, so just one of those single positions, has decided to retire. And then we had some speech pathology vendors that were not really providing a lot of support for our clients, decided to close down as well. We have, and same thing with the C&J payee, another one that was smaller, and we're absorbing with our other payees. And again, the focus on Placer County, the R-Care of Placer County, and Studio 700, the work that Jacob Maddox has done. And as always, we will be highlighting some work that's being done by our clients in all of our newsletters. At the end of this, we have our coordinated family support services request for proposal. And I didn't see Jason on, and poor guys had to give presentations about this. I don't know, this might have done it like 20 times already. So with that, you can see we have the RFP that Jason worked on. I know we went on it went over it here 2 weeks ago in Coffee with Community Services and talked with, or 3 weeks ago, actually, now that I think about it. But Jason's information is on there. I believe, what did we hear, Michelle, that we've got 7 applicants so far, 7 vendors that have reached out to us, I think?
Yes, we have. And Jason is taking a well-deserved day off today. So we have had that, but we actually have had, I believe, 2 LOIs come through that Jason's working with.
Excellent. So we've got even new folks that are looking at working with us as well. So that's the Coordinated Family Support Services. We've also been having meetings. I know we had a meeting with our Coordinated Future Planning Task Force because we are going to be, well, one of the reasons why we had the meeting was talking about, when we are talking about caregiver succession planning, when we are talking about aging caregivers, when we are talking about, and I was talking to one of Heidi's family members up in the Grass Valley office during my family meeting yesterday. And we hear so much about the concerns that people have about, my service coordinator has 70, 80, 90 people on their caseload. Can there be someone that just has a smaller caseload? I am getting older and I need help managing these things. I need help managing these different services. And so we talked about being able to kind of utilize coordinated family supports and thinking about it in that vein and advertising it kind of that way is that, we recognize that we're not going to go back to the way it was before. This is not going to be the 70s where 85% of people with developmental disabilities lived in congregate care settings that were eligible for the regional centers. That's how it used to be. Now, folks are not at home, and we have a very small percentage of our clients that are living in residential care facilities, certainly in developmental centers, as so many were back then. So if individuals are living with their families, and if they're going to be able to continue and wanting to continue living with their families, then it's talking about adding extra support for those families. So the Coordinated Family Supports, it is a pilot right now. Even the number of hours a month for services is something that DDS is kind of trying to figure out. I don't know of any regional center that has anyone vendored yet for that service. I'm sure everyone is just like us, doing our outreach and trying to get the services going. But for you all as service providers, if you know family members that are struggling with this, if we can get some of these services vendored, I just want folks to be mindful of those aging caregivers that may really benefit from having someone come in and helping both facilitating the services or in some cases being an emergency backup for different services as well, which is certainly allowable too through the Coordinated Family Support Services. So that, just want to kind of talk about that. And again, as I mentioned previously, that went out to all of our people that are signed up. They get the newsletter, and it went out in all the different languages that we have as well. We're going to vendor who comes in front of us, but we really want people that speak different languages. And we really want people that can serve outside of Sacramento County when it comes to this. Because in some of those under-resourced areas, this might be a way to be able to get some things. And I'll be honest with you, like for Heidi and her, we'll pick on Grass Valley right now for a moment here. If you're dealing with like the planning teams there, like, are we worried about duplication of services for people that have no services? No, we are not. And so this might be the only service that we might be able to get to someone in some of these different areas. And so just, again, this is the new service. Hopefully we have more of it going to be available to you all. And I would say the same thing. Sharon's not on here, but in the El Dorado County side of things, same situation. We have a real limited number of services that are available. And it's a new and different type of service, right? So a lot of families maybe have never thought they could get this type of support in homes. And so we will certainly keep you all updated as we look at doing more vendorizations for that service. Yeah, Tahoe Truckee. I was thinking about Paul Fisher in my head right now. And I was thinking Tahoe Truckee, same situation, right? It's just so under-resourced. We were talking about health and safety waivers and just the amount of money that it takes right now to hire a DSP up in those areas when you're competing at like $22 an hour plus for fast food jobs. Like it really makes it a challenge to get DSPs and bring them in. So we are going to be talking more about health and safety waivers. I think I mentioned it earlier, but we're going to be doing a presentation coming up I think it's going to be this month or next month. It'll be next month to our provider advisory committee to go over kind of some, we've been working on a one-page description, but we want to do a presentation to them. And then we will do a health and safety waiver presentation here as well for Coffee with Community Services, where we go over it, make sure everyone's kind of on the same page. Injury crew?
I just had a question about the coordinated family services. If I have specific annoying questions about it, I should direct them to Jason.
Absolutely, yeah. Just shoot Jason an email. He's starting to, and really would love to hear what questions you all have as well. Like, and if, especially if you might be apprehensive about doing it. So that would be.
I think I'm just trying to kind of like comprehend what it is compared to my other stuff, I guess is sort of maybe, yeah. It sounds like.
Yeah, and that's why we hired, and that's why we had Jason do it too, because of his background. He's familiar enough with what all the other services are, and so talking about the differentiation, you know, and then talking about the rates too. I think we landed $64.58, I believe, is the hourly amount if you do all of the reporting that DDS is asking for. So I think it's 55, and then on top of that is the rest. In the chat, there was a question about the social recreation grants. So ACRC was allocated $786,000, but only see about half of that awarded in ACRC grants. Was there less funding coming to ACRC? Ellen, do you have the answer to that question? I don't know if I know that answer. I know we submitted what we submitted, and then the department let us know which ones they were going to approve, and then for those that they didn't approve, they had a leftover pot of money, right?
Yeah, we really don't have control over, you know, who they are going to approve, John. So they just approve the people that they approved and let us know about it. And
so, and refresh my recollection too. So if there is a question that folks have about that, are we going to be able to refer them to the social rec grant people over at DDS for answers, or does DDS want us to handle that type of stuff?
no, yeah, I think they can email the social rec email address. Do you have it, John? I don't have it right now, but let me see if I can find it and I can drop it on the chat. Yeah.
Thank you. Yeah. Again, this is one of those things where we didn't really, we did not have the final say on the awarding. They let us know which ones were and weren't.
Yeah. I believe we can assist though, John, if they have some questions and if we need to schedule or talk to somebody at DDS, we can assist. I know that Christy has answered some questions and communicated to DDS, so we definitely can assist in facilitating a meeting with them if we have
and I'll
to.
just drop in the chat is the email address for them. And
Yeah.
So, and I got it right now. It's just socialrecgrants@dds.ca.
Oh, there you go. Yeah. Thank you, John. Yeah. That's the email address.
All right. We've got through 19 of the 20 agenda items that we had on here, plus all the other stuff that I added in. We are working on getting all of our vendor forums onto our website. It did not look like they were on there yet, right, Michelle?
Correct. No, and I will touch base with Herman because we are working on getting those on there.
So we'll update those and get those on there. We do have on though. We have. I'm just going to show our events calendar real quick. We do have some upcoming events on the calendar, and let me just share my screen real quick so you can see that. So we have. Let's see. So this is April 11th. Public hearing for stakeholder and community participation for proposal for alternative service coordination. Anyone involved with this meeting that wants to talk about this at all? This upcoming one? Going once? All right, there it is. We've got that on there. We've got our provider advisory committee meeting on there at 9:30. Certainly want to encourage everyone to attend because I think we might have smaller attendance, right? We have another conference that's going on next week. I think the CSLN PAVE conference is going on down in San Diego during that period of time. So we might not have a ton of people. And then please make sure that you have on your calendar the Disability Industry Career Expo. We will be verifying next week all the people that are signed up on there. And then, of course, we have our Self-Determination Advisory Committee that we have on here as well. We are doing a new landing page for housing and all of our housing information. And it's supposed to be allegedly done today. But so far, it's just a little header page. But this is going to be where we're going to, it's under the Resource Center, and this is where we're going to be putting all the information about finding housing, all of our different living options for the regional center, and then updating folks on our housing development activities, which some of you may have seen. We are hiring a housing specialist at Alta California Regional Center. Alta is the regional center that is going to be doing DDS's technology pilot. So there was a pilot that the Department of Developmental Services had built into last year's budget, which is to look at utilizing assistive technology and ways in which we can support people to live more independently, get services in their own language, and cut down on the necessity for that workforce that is such a challenge to be able to get right now. And so Alta had already started doing something like that with our $10,000 grant that we have for our assistive technology unit at the Mirasol Village housing development. That's one thing that we had on, but now we're going to have a much larger project that we are piloting, and it will involve probably about 30 or 40 clients or so, and getting these types of supports put into their homes. And we'll be working in our area, and then also in the East Bay area with some different service providers to look at working on that pilot. So with that, we need someone to help out with that. And so the department has given us a job position at the regional center of a housing specialist that can assist with a bunch of these housing development activities, and also the lease up activities that are going on for those new units that we have in our affordable housing complexes. So that's a new one. I'm interviewing candidates. I think that's kind of my next step. So we've already got some resumes that have come in. I think it'll be really nice for our regional center to have a housing expert, and thinking about our client services managers and service coordinators, someone that can do a training, and an Alta staff person that can do a training on things like housing vouchers, and so that our staff understand them a little bit more. So anyways, that's a new position that's going to be directly under me at our regional center. Let's see. It is 12 o'clock. We have Passover and Ramadan and Easter and all kinds of fun things going on. So I think we should call it for the day, folks. This recording will be up on our website. I hope everyone has a great weekend. Very happy holidays here. And we will look forward to talking to folks next week. We'll give some updates on the job fairs next week. That'll be our plan. All right. Thank you, folks. Have a great rest of your day and a great weekend.